Here's this week's viewer question. What can you do to prevent colon cancer? And with us, we have our expert,
Yes.
our colorectal surgeon himself to help
So
us
what can we
answer
do to
it.
put you out of business?
I think the most important thing is to know your family history. Is there anybody in your family who has a colon cancer, especially at younger age? Second thing is do a regular colonoscopy. Once you hit 50 years, you should get your first screening colonoscopy, and then from then on, you should get a regular screening colonoscopy.
And I know they say to start even earlier if you have a relative who has a first-degree relative who has cancer at a young age.
Correct.
I think they say 10 years before.
10 years before.
Younger than the age of your brother or sister or mother when they had their colon cancer.
Also to recognize, I would say, right, any changes in your bowel habits, signs and symptoms that you may have something going on that may be more than just a hemorrhoid or things like that we talked about. But what about other, I'm sure there are a lot of perceptions out there that if you avoid certain foods or if you take such and such supplement, you may be able to prevent colon cancer or any other cancers. Is there any truth to, and I don't know if you know of anything in particular that's out there?
Well, we talked a little bit about fiber, so a high fiber diet, low red meat, but I know there's been some talk about folic acid, some talk about aspirin and similar drugs. What's the state of knowledge about that?
Okay, so aspirin to some degree decreased the inflammation in the colon, which inflammation thought to be related to developing colon cancer. So I think there is a certain degree of protection from aspirin-related products. There was some, in the past, there has been interest in the selenium and other trace minerals and the protective effects of the colon cancer. Vitamin D could be one of them. The degree of protection from those agents probably, I would say, modest. So you should not really rely on those things.
So just because you're taking aspirin a day doesn't get you out of your colonoscopy.
Right,
correct.
Right, nicely put.
Yes. So I think that's all we have time for, but the real message for everybody at home is to make sure you get that colonoscopy when it's appropriate. And so if you at home would have a question you'd like to ask on Health Talk here on TV, please contact Vicki and me at healthtalk@norwalkhealth.org.
We would like to thank our guest today, Dr. Junho Shin, for coming on our show, and we'll see you next week on Health Talk.
Bye-bye, and get your colonoscopy.